The healthcare system is really complex and fragmented, particularly for those members with complex or chronic conditions. So we actually created an entirely new program that's really centered around the individual. And the goal of the program is to find those individuals that we think we can make an impact on and surround them by the resources that can actually help them get through the system in the most impactful way. Blue Cross Coordinated Care delivers a holistic, member-centric approach to care management. The program is designed to directly impact the health, costs, and experience of identified members. Keep watching to take a closer look at how the program works. The first thing we had to focus on was finding those individuals that we actually think we can make an impact for. So we really deployed an entirely new way of targeting individuals informed by analytics. Using more than 30 data sources, we identify members who may benefit from care management. These are typically members with chronic or complex medical conditions. We also use predictive analytics to identify members who may have future health risks to offer preventive and proactive actions. We didn't want to leave that member on their own, so we wanted to make sure that we had the right support teams around them. The primary point of contact for a member is their nurse, who really acts like the quarterback. They're the facilitator of things for the member. Once a member is identified for the program, a Blue Cross Coordinated Care registered nurse reaches out to them. Those who agree to participate are placed in a custom care program to improve their health and well-being. Nurse-led Blue Cross care teams are the backbone of the program. Nurses work directly with program participants and engage the care team as needed to connect members to the right care to meet their specific needs. Care teams include medical directors to work directly with members' doctors and provide medical expertise, pharmacists to educate and advise about the right medications, dietitians to provide targeted nutritional education, social workers to address non-medical health factors and locate community resources, and behavioral health specialists to help with stress, depression, anxiety, and other issues. We've also deepened our level of care to reach program participants with highly specific needs, such as diabetes management. So we really wanted to understand the local nuances where our members live, because things that are taking place in Detroit are very different than things taking place in Grand Rapids versus the UP versus our members who live out of state in California or Texas. Conditions in the communities where people live, work, and play impact their health outcomes and risks. That's why understanding the social determinants of health is an important part of Blue Cross Coordinated Care. Our care teams are aligned with the different regions where members live, leveraging close relationships with local facilities such as doctors' offices and urgent care centers. Our care teams know whom to call and where to send members for care. Our nurses and social workers are also deeply linked to community organizations, connecting members to food delivery services, transportation and health services, and more. This regionally focused approach allows us to balance and optimize care across provider systems and time zones, using demographics and member insight. And then lastly, this idea of being able to be connected, meeting our members where they're at, being able to establish a relationship on their terms, having this app and a digital platform that allows us to do that, it creates a whole new way for us to interact with our members to meet their needs. Convenience and one-on-one support are key features of Blue Cross Coordinated Care. Program participants can easily connect with their nurse through secure messaging on the BCBSM Coordinated Care app. The app provides convenient access to personalized care management programs, care-related reminders to take medications or set doctor's appointments, monitoring for health and wellness progress, weight loss, and dietary goals, checklists that offer education, encouragement, and daily tasks to support care plan compliance, and brief survey questions to help care managers understand members' conditions. Blue Cross Blue Shield of Michigan is committed to delivering smarter, better health care, including addressing the total cost of care, improving our members' well-being, and creating an easy, useful member and customer experience. It is a great example of Blue Cross bringing the best of Blue Cross to our members and serve our customers. I'm thrilled to see the program be up and running and live, and the stories that we're already hearing about the impact that it's making on our members is why we did this. So I'm very happy. To learn more about Blue Cross Coordinated Care, visit bcbsm.com/care management or contact your Blue Cross Blue Shield of Michigan account manager.